for more on the latest recommendations and the situation at large, let's go to Chris Smith. He's a clinical virologist at Cambridge University. Welcome to the program, Chris.
Hello.
So, should people who are vaccinated be wary of the Delta variant, especially in light of these new data suggesting the Pfizer jab may not be as effective against it?
I think anyone should be wary of coronavirus. Look at the cost it's unleashed on the planet. But certainly people who are vaccinated are in much better positions than people who are unvaccinated. The data we have in the UK is that if we look at who has caught the Delta variant so far, there are hundreds of thousands of them, then actually 58 to 60% of those cases are among the unvaccinated. The people who become severely unwell, they add up to only about 8%. So in other words, people who've been vaccinated with one shot of the vaccine might still catch the infection, but they don't become severely unwell. So that's why there's a big push on to try to get at least one, if not both doses of the vaccine into all adults in the UK by the latter half of this month.
I mean, the world is sort of struggling to get everyone vaccinated, and now we're already talking about booster shots. So is that worrying?
Well, it's a big challenge, isn't it? Because we think conservatively there are about 8 billion people on Earth, and optimistically, probably about 1 billion have so far got immunity to coronavirus, either because they've been vaccinated or because they've caught the infection in the past and they now have some semblance of natural immunity, of course, notwithstanding the possibility of reinfections coming along. So yes, it's certainly a concern, because until we get rid of COVID or get it under control everywhere, it's a problem everywhere, because as your previous report highlighted, these things are on the move and we're seeing lots of countries with lots of activity and the virus spreads. It doesn't need a passport, it just goes where the people do.
Right, in one of those countries, Indonesia, seeing a wave of deaths attributed to the Delta variant. The country is also experiencing an oxygen shortage. Do you foresee it getting as bad as India experienced a few months ago?
Well, what has happened is that countries like India, a really good example, who weathered the initial storm of coronavirus very well, then thought that it was over for them and they thought they had it under control. There was some degree of loosening and maybe an element of complacency. There were mass gatherings, people were congregating together, there were political rallies, and this disclosed, initially unforeseen to everybody in India, this Indian variant. In fact, it disclosed 3 Indian variants, of which the subtype 2 variant is the one that's causing the biggest headache, and endowing upon that virus, those changes, the ability to spread much better, probably 70 or 80% better. In other words, if you take a person who's infected, they will infect 70 or 80% more people from being infected themselves than if they'd caught the original coronavirus. So when you're faced and confronted with something that spreads a lot better and may in fact even reinfect people who've had it before, then you intensify what was already applying pressure to an impoverished and weak health system. And unsurprisingly, the whole thing then melted down. And this is beginning to play out in other countries as well, which are seeing similar surges with this new variant, which is more transmissible. And this means that the measures that were controlling things previously may now prove to be insufficient.
And despite some of these surges in certain countries, where you are, the UK is ending all its restrictions. British Prime Minister Boris Johnson says people will just have to learn to live with the virus. Is that our future? Will COVID be with us for a long time yet?
Well, one of the people who was on the podium this afternoon alongside Boris Johnson was Sir Patrick Vallance, who is the UK Chief Scientific Officer. And he, over the weekend, said very glibly, but I think very accurately, there is zero chance of zero COVID. And the point he's trying to make is that this is not something that's going to go away. It is not something we can get rid of. There are various reasons for that, not least that it's an environmental infection. It came to us from nature. We haven't found the source, and therefore it's presumably still out there and could just leap back into humans if we were to try and suppress and eradicate the agent. So we're not going to be able to do that. So the best we can hope for is to plan for some kind of living alongside coronavirus, where we can tolerate some level of activity in the population, but we take steps to protect those who are most vulnerable. And we're doing that at the moment, of course, with vaccination. The aim being that if you vaccinate everybody, then everyone has some underlying immunity, and the chances of severe infection are massively mitigated. And indeed, the data we have, that appears to bear that out, because we've gone from a situation where perhaps 1% of people vaccination against coronavirus may have been losing their lives if they caught this, particularly elderly people. That's now down somewhere in the order of 1 in 1,000 elderly people if they catch the infection. So certainly the vaccines seem to have turned the tables on the virus.
Chris Smith from Cambridge University, thank you for your time and insight.